Hi, and welcome to our show. I'm holding an article from a Northwest Indiana Times newspaper, and it's about a new development for hearing aids. And if you, like I, have experienced other people having hearing problems or have experienced them yourself, you know just what a terrible problem this is. And although it's not usually told as a terrible problem, it can affect your socialization, it can affect your work, it can affect anything, even your relationships. I myself experienced a swimmer's ear, which caused me to go deaf for a while, and I couldn't hear one side of the table at a dinner at a club I belonged to, and I'm sure that my answers to other people's questions were incorrect. So we have the solution here for you, and the inventor. So we have Dr. Cherukuri here, and I'd like to welcome him. Doctor, thank you for joining us.
Thank you for having me.
You obviously have been in this specialty for a long time.
Yes.
And have dealt with some of the things that I'm talking about. So you are the inventor of the solution. So we want to talk about some of the diseases of the ear, some of the things that we can tell people about, and the solution to their problem.
Certainly.
So go right ahead. Let's start with the major problem that most people have with hearing.
Well, hearing is a very important, vital sense. It is the way we communicate with other people in our family, our work environment, our friends, and it's also the way we enjoy our environment in the terms of music, or going to restaurants and conversation, and playing with our grandkids. Unfortunately, as we get older, like a lot of things, the hearing does tend to go, and we also know that noise is a big contributor to losing hearing. And so traditionally, hearing loss affects people, but they don't really act on it until 5 to 7 years after the onset of hearing loss. The reason for that is, there's many reasons, but one of the reasons is the person with the hearing loss doesn't recognize early on the effects that the hearing loss has on things like we mentioned, their job, their wife or husband, their family. They don't realize what they're missing out on or the problems they're causing until many years down the road.
You know, I've literally sat in a car one time as the passenger. The driver and the person in the back seat both had minimal hearing loss. They had a conversation that made no sense because of, to me, because I mean, I had to laugh, but it's not funny, because one would say one thing and a word or two missing would change the meaning, and the other one would react to that, and then that would change, and then this one wouldn't hear it, and the whole conversation in essence made no sense because they didn't know what the other one was talking about.
Right, and that's very common, and and that's really how it starts affecting family members. If one person has a hearing loss, the whole family has a hearing problem. And we do see that a lot. It's rarely the person that has the hearing loss comes and sees us. It's the family member brings the person in, and it's usually after months or years of telling them, you got to get your hearing checked out, this or that. Unlike a lot of things like vision or other conditions like arthritis, the person with hearing loss, it occurs so gradual that they don't really notice what they're missing, but the other people do, and they really start blaming others. Oh, they're mumbling, they're just low talkers, oh, you weren't speaking loud enough. And so it becomes a pattern of denial.
Or the other person has to keep repeating it 4 and 5 times before they understand what they're talking about.
Right, and actually the loved one or the family member without the problem actually becomes an enabler, because by repeating or helping them, they actually can prolong this problem. And so actually one of the things that we as doctors and people in the hearing health field are starting to tell people is, don't become an enabler. If someone says, what did you say? Make it obvious, maybe with a finger, I'm only going to say it once, or something more than just you're repeating, because it's easy to repeat. But if you make it obvious to the person with hearing loss how common they're asking, then it's earlier in the chain they maybe go and get treatment.
I don't understand how they can stand it at all, because as I said, it happened to me from a swimmer's ear, and it was very noticeable to me immediately that this whole side of the table at the dinner I was at, I could not understand. Maybe I could hear a few words, but I could not understand what they were talking about, and it's totally embarrassing. And then my nephew came over one time and said something, and I had it in both ears, and he said, "Are you deaf, Aunt Karen?" And I said, as a matter of fact, I have to get this taken care of because it's terrible.
Now your experience is a little unique because it was sudden.
Yes.
You had intact hearing, and then maybe a week or a few days later you did not. I actually think most people with that do come in. But when it's slow and gradual over the onset of years and years and years, and maybe they're in retirement and their life is slowing down, they don't notice it like you did. And so it's such a subtle process that they don't say, I have to get this fixed, until someone else points it out to them.
But don't they notice that they no longer want to talk? I mean, because that's the other thing, because then when they do notice that they can't understand the other person, then they don't want to get into conversations as much with people either, because of the fact that they absolutely will not know what the person's talking about.
Right, and actually the studies are out there. Medical studies are very clear that untreated hearing loss in the elderly lead to social isolation, depression, anxiety, paranoia. Those are very, very clear effects on the quality of life. But what you said is you'd have to really, the person would have to look 5 years ago and say, yeah, I used to go to restaurants and concerts and church and bingo or play with my kids. It's really hard for them to notice it, especially when the other family members are enablers and helping them as opposed to making it obvious.
But they would notice, like if they go to a restaurant, they're not hearing somebody ask for their order. If they go to a movie, they're missing words.
Right.
If they're watching television.
And part of it is it's so gradual, they don't even know what the problem is. Maybe they think it's like I said, they think it's something else.
It's somebody else.
And also, no one really thinks of a hearing aid as a quick and easy solution to this thing, partly because there's not a lot of education. There have been studies about how many doctors, like primary care doctors, screen elderly for hearing loss. It's 9 to 15%, 1-5.
That's it.
It's a very low number. And the other thing is in the quiet environment of a doctor's office, a lot of people with hearing loss can hear well, because the doctor's speaking right at you, they can read the lips, and the doctor may not recognize it. But it's some of the doctors in the medical studies are talking about the epidemic of hearing loss, which is a combination of the baby boomers getting older, plus the combination of all the noise exposure from iPods and music players and things like that.
Well, I see the biggest obstacle that I hear seniors talk about is the cost.
Right, and that's something else a lot of people don't know until they or a family member need it. Medicare will pay for the doctor visit, they'll pay for the test, they won't pay for the hearing aid.
They won't pay for the hearing aid.
And it's a real interesting irony. They'll pay for a cochlear implant, which is $50,000 to $100,000. They don't cover a hearing aid.
That you have to be totally deaf to get that?
Yeah, in both ears. It's obviously it's a major surgical issue, and it's not commonly indicated. But even most insurances, along with Medicare, they don't cover hearing aids. They think of it as I don't want to say cosmetic, but it's not in the realm of medicine.
But you know what? It's such a preventative thing, because if a person who can't hear is driving and they don't hear an ambulance or they don't know where it's coming from. Now, we had an interventional radiologist on the show one day, and he had lost his hearing in one ear. And he said, you know what? The problem is when you go to find something or you hear a phone ringing, you don't know where it is because you can't identify where it's coming from anymore.
Especially if it's one ear.
Right.
That's correct. You need 2 ears for spatial orientation.
Right.
That is correct.
So, okay, so then if you're in a car and you're driving and you can't hear an ambulance coming, or you can't hear a horn beeping, or if you're riding a bike and somebody's trying to warn you, it's serious.
There's no question to me it's a medical condition that has a medical treatment, which in this case, a lot of the insurances will cover a wheelchair, a walking cane, other assisted disability type devices. A hearing aid really fits in that category. But for whatever reasons, over the course of time, it has been excluded from coverage from most things. In the USA, 23.5% is the number of insurances that cover hearing aids.
I'm surprised to hear any of them do.
Well, you know what? Some of the noisy industries like steel mills and Ford Motor Company, for example, they do cover because they recognize that noise-induced loss occurs as a part of the job, and so they have good coverage, but very few.
Well, policemen have a big problem because of the shooting ranges and stuff like that.
We see a lot of police, and actually they'll get sudden hearing loss from one gunshot if their ears are unprotected. It's unfortunate.
Really?
And that's permanent.
And of course, kids with music these days and blaring music.
They actually did a study about 18 to 22-year-olds. 20% had some hearing loss, which is 1 in 5, which was worse than their hearing of their parents. So we're seeing it at a younger and younger age.
Oh, that's
Part
sad.
of the issue is if you go back 20 years when they had Walkmans, they had 2 AA batteries that might last 4 hours playing a cassette or CD. The headphones went over the ear, not in the ear. Now the iPods can go 8 to 10 to 14 hours, very high volume. And for whatever reason, in the USA, there's no decibel limiter, whereas in France and other countries, they made a mandatory decibel limit to protect the hearing. So yeah, we're seeing...
What made you decide to go into this specialty?
So ear, nose, and throat, or otolaryngology, is a specialty. It's actually a fascinating specialty, and that's a discussion of itself. But we deal with babies all the way to the elderly. We treat people medically and surgically. So it's really the whole gamut of medicine in one specialty. And so it's a very attractive field for me.
Now, speaking of that, a lot of children and babies have these problems with having water and things like that in their ear. And you treat these with tubes?
Well, a tube is the surgical last resort. Ear infections in children is very common. And if we could look at this picture here, what happens is the ear, here's the outer ear, the eardrum, and here's the eustachian tube. That's what connects the ear to the nose. And it's the structure that allows us to pop our ears, or the ears pop in an airplane or elevator. This structure and the muscles around the structure are not fully developed till age 3. So it's what equalizes pressure in the middle ear behind the eardrum. And so babies and children, young children, they have what we call eustachian tube dysfunction. And so they have negative pressure or a vacuum type setting in the middle ear, which causes fluid and bacteria to come in, and they get frequent infections. If antibiotics don't resolve the problem, or they're on frequent antibiotics, a simple procedure of putting a small hole in the eardrum will quickly equalize the pressure in the middle ear. It will allow fluid that builds up to drain out. It also allows, the most important thing is, it allows topical antibiotics to be administered so the body doesn't see oral antibiotics and build up resistance.
Yeah, do you use a lot of ear drops for kids? I always thought, you know, I had a terrible earache when I was a kid due to tonsil problems and stuff like that. But actually, as I got older and became a nurse, somebody prescribed ear drops one time that took my earache away in 10 minutes. And I thought, this is a lot better than taking oral antibiotics. It was great.
Right. I mean, ear drops only work for certain types of things. You mentioned swimmer's ear before.
Right.
Swimmer ear is actually an infection, a bacterial infection of the outer ear canal. And the treatment of choice for that is a topical ear drop. You don't need any oral antibiotics in most cases. And so when we see those, we'll make sure the ear is clear of debris, and we'll prescribe an antibiotic or an antibiotic and steroid combination ear drop. And in just a few days, the patient's much better. But if they see a non-ENT doctor, they often get oral antibiotics in addition, but the oral gets very little penetration to that portion of the skin.
I was going to say, when I was in school, I remember learning that there's very few drugs that pass the ear canal that will pass into it, that you have to have the exact right antibiotic.
Right. And that's why topical is very,
very
very effective, as you can imagine, and it's very safe.
Well, it also affects the skin in the ear, and that can get hardened, and then the ear canal can close on you, right?
Oh, yes. In severe cases, we call that stenosis of the ear canal, or narrowing. The swelling and infection are so bad that even the drops don't work. And in those cases, we put what's called an ear wick. It's a rectangular sponge, and we force it through the swelling. It sits right here. And what it does is it allows the drops, the medicine, to sit there and topically work, and over time, it opens up the ear canal.
What about vinegar and distilled water?
You know, vinegar is actually very effective. One of the issues with ear canal or swimmer's ear is the pH is disrupted. And vinegar, which is an old wives' or old physician's trick, is actually very useful to bring the pH proper to the ear canal. So people that get repeated infections, we don't want them also on an everyday antibiotic. We would recommend vinegar type irrigations or rinses to the ear canal. And those
Do you
work
use
very well.
peroxide too, or not, or oil? Some people are talking about putting oil in their ear for earwax.
Well, yeah, earwax is a common thing. Peroxide works very well. Oil mainly can soften the skin. It doesn't have a great role for earwax, but it does if you have dry skin or itchy skin of the ears. A lot of people have itchy ears. The mineral oil or sweet oil some people talk about, those work okay for itchiness.
But now, they used to remove wax with those flushing instruments. But you have other instruments now that just take it out, don't
Right,
you?
it depends on the patient, age, and their comfort level, but actually the flushing works quite well.
Does it?
But there are curettes and little devices that can remove wax. We can put the patient under a microscope and really get accuracy. We use suction when indicated. And so we have a lot of ways to remove earwax.
How often do you get really, really serious problems in the ear besides hearing loss? I mean, is there a lot, or is there a certain age group?
So probably 50, 60 years ago, before the advent of antibiotics, is very common. These ear infections would start in the middle ear and then go into the rest of this honeycomb type bone called the mastoid. And those infections were extremely hard to rid, and those were actually a surgical condition. The indications in this day and age, it's very uncommon to see that level of disease because of antibiotics and the prevalence, and also the access to medical care is better. But we do see it in patients without health insurance or people that have been in foreign countries, and we do see it from time to time, a mastoid infection, but our antibiotics and our IV treatments have gotten quite good. So that's a less common surgery
Mm-hmm.
for a bad ear infection, but it can occur.
Is there ever cancer in the ear? Do you ever see that?
There is. It's also rare in terms of all cancers. You can get skin cancer really on any part of the ear, which is common because it's a very sun-exposed area. But in terms of ear cancer, it does occur. It's rare.
And would that be on the skin in the ear or actually in the eardrum?
Well, the eardrum, it would be actually on the skin, but I actually had a patient in my training, and she had a bad habit of bobby pins. She would stick bobby pins in there to itch or whatever for years, and it eventually caused so much irritation to the area, she developed a cancer. And cancer in this bone, in this area, we're very close to the brain. That's a bad condition, but it's very rare.
Well, what about Q-tips? People have a tendency to want to do that, but they usually say don't do that.
Q-tips are very cleverly marketed because they're perfectly sized to fit in the ear, but they warn do not put in ear on the box as a small afterthought. But yes, Q-tips do not belong in the ear. Nothing really belongs in the ear. The people ask then, how do you clean it? The ear is actually self-cleaning. The wax migrates out. If you're in the shower, you can rinse out your ear by letting water run in there. Most people, that's fine. It's the rare person that little bit of water will cause an infection, but yeah.
Can you do it with pressure, like with the handheld thing, or are you just supposed to let it run in there?
You can actually do nothing. It's actually perfectly fine, but if you felt like you wanted to clean it, water, pressure, gentle pressure is fine.
So now you saw these problems happening, and you wanted to solve these problems.
Right, and it's an interesting thing because most of these problems that we've talked about, we can solve. There's only a few problems we can't solve, and ironically, one of them was a patient that had hearing loss that didn't require medicine, wax removal, antibiotic for an infection, or any kind of surgery. They just had simple age or noise-induced hearing loss, but they didn't have the financial means to buy a hearing aid. The average cost of a hearing aid now stands at about $1,600 each, and as we mentioned, most insurances and Medicare don't cover that. So you're looking at $3,200, which is a pretty penny.
That's a lot of money.
I mean, that's before the economic crisis and all that. That's a lot of money for someone to pull out, and that's a main obstacle to why people don't get hearing aids.
And they also are tiny, and some people lose them, or they say that they didn't get fitted right, and they still get background noise or something like that. So they hesitate to spend that kind of money.
Right. It's not a perfect solution because unlike glasses when you're younger, which is mainly a physics problem with an intact nerve, hearing loss has, in most cases, has nerve damage that's permanent. So the clarity and some of the other features that would make someone hear perfectly, you can never get, I shouldn't say never, it's rare to get a perfectly hearing result in most elderly with age and permanent nerve damage hearing loss. So what we're talking about is a very expensive product that will only give you at best a less than perfect result. Plus, you mentioned some things about the size. The elderly may be a little bit less able to handle real small items, and there's a lot of issues with noise and feedback and comfort. So those are all big obstacles that the industry is trying to figure out. But right, I mean, back to what I was saying, one of the unfortunate things I would have to tell people if they couldn't afford our entry-level hearing aid, which was $800, was, I'm sorry, I don't have a solution for you. And that just didn't seem right.
Right.
It's one thing if it's terminal cancer or something like that where there is no cure, we tried all those things, but hearing loss, we're in America, everyone should be able to afford there should be a good, simple device for people that can't afford the more expensive, fancy, personalized, custom devices.
So you became an entrepreneur?
Well, more than that, just a problem solver.
Yeah.
It really, really where the idea came from is when the iPhone came out and the iPod Touch. I mean, these are remarkable devices with remarkable technology that cost around $200. And so that idea came to me that you could take a credit card, you can program it to turn off your lights, you can surf the internet, you can make a phone call, you can do almost anything from an iPhone, and it's under $200. But so why can't we make a pretty good hearing aid for under $200? So that's where the idea came from, and then just really looking into the concept of what are the obstacles, and one of the big obstacles of a hearing aid. Let's say you needed a hearing aid, so you'd probably talk to your general doctor first. They may refer you to me. The ear, nose, and throat or otolaryngologist, we're the entry point for hearing health. So I would examine you, make sure there's no medical conditions. Then either same day or another day, depending on the office setup, you would then get a hearing test, and we'd go over that. So you're now at 3 visits. Then if it looked like you were a good candidate for a hearing aid, we would then have to convince you to get a free hearing aid consultation from our audiologist. That's visit number 4. Let's say you were motivated and you want to sign up at that time for a trial. They would maybe take some measurements or make a mold of your ear canal. You come back 2 weeks later after the device is delivered to the doctor's office for a fitting, and then one or several treatments or visits for fine-tuning. So you're talking about a 6-visit, 6-week process.
It's a long process.
$1,600 each ear.
Yeah.
So that was those are all roadblocks to me for people. There's a lot of seniors that can't really make 6 visits, and so again, we're dealing with, in most cases, a less than perfect. You're not hearing 20/20 at the end of the day, unless you're real young.
So what's the solution? We've got 10 minutes. I want you to show us the solution.
So what we came up with is just a very simple, functional, effective hearing aid solution that's under the $200 price point. We call it the MD hearing aid, which is a very simple name.
What a gift of hearing that would be to a family or a patient. Or I'm calling them a patient, but they're not really necessarily a patient. It's just a person that's having this problem.
Right, but I mean, I consider all of these people patients because they have a medical condition that really is being without a solution until now. It's a very simple hearing aid. It's not big, it's not small, it's just the right size. It comes with different...
Can I hold this up?
Certainly. It has what we call 2 channels and an on-off switch, so that you can see the switch there. So what it allows the user to do is if they have a flat loss in all frequencies or mainly a high frequency loss, there's a switch that will help them with that. And then in terms of the fitting, it comes with a different length of tubing that connects the hearing aid to the ear. And then different sizes of ear tips.
So now, does this fit into the ear?
That's actually a behind-the-ear model.
A behind-the-ear model.
So it's going to tuck behind your ear. All you're going to see...
So for a woman, you wouldn't even notice it, ever.
Right, no, you wouldn't notice it. And even for a man, all you see is the tubing that goes from behind the ear into the ear canal, which is the same as many hearing aids today.
I don't know, can you get a close-up of this to show how you can't even barely see that? And it's so lightweight, I don't even feel it.
It's very lightweight. It's less than an ounce, and the tubing.
Nobody can even see it.
now the design of this allows the user to trim the tubing to their length of their ear. You pick the tip or the dome that fits your ear canal, so you're getting almost a custom fit hearing aid in the comfort of your home. Now it's not truly custom fit like the expensive ones, but.
Now this is called, I want everybody to know this because we get calls about these types of problems all the time, and this is made by MD Hearing Aid. So you can go to their website, and I'm sure they'd be happy to send you out one of these brochures,
right?
Yeah,
the brochures are free. We've made it as effortless as possible for people to try these. It's a 45-day period where they can try it and return it. They get
what
all
a
their money
wonderful
back.
gift this would be to give somebody for the holidays.
Right. In fact, in that regard, I mean, there's really, what gift could you give somebody that would give them the ability to reconnect with their spouse, enjoy time with their grandchildren, go to restaurants, movies, and really live life again like they did 5 or 10 years ago.
I just can't believe how nice and lightweight and everything this is. Because a lot of people say, well, I don't want to wear something that people can see. But these days, people are wearing things for telephones and everything. Nobody knows who's got a hearing aid, even if they can't see it.
No, you bring up a very good point. And kind of one of those things we were talking about is the effect of hearing loss on a marriage. The spouses have said almost 50% of people where one spouse has hearing loss, the marriage really suffers. And so this is the type of product now that someone could give as a gift. It's priced below iPhones or digital cameras, for example, and you really can change someone's quality of life or a whole family's quality of life.
And it's made by a doctor, so you know it's going to work. No, because I mean there are things that are on the market that are inexpensive little gadgets that you can get at the drugstore,
and that's the trick.
And they don't work.
That's an excellent point you bring up because there's products that are actually less expensive than this, but they're not hearing aids. They're sound amplifiers, and that's kind of a loophole. Sound amplifier is a recreational device that can make sounds louder, but this product, the MD hearing aid, is an FDA registered Class 1 medical device. It follows all the regulations just like a hearing aid. And so it's a legitimate.
And you don't have to have a hearing test for this.
Well, we always recommend.
You recommend that you do.
Yeah, the FDA does not require it, but we recommend. It's always in the best interest of the patient to get a hearing test and see a doctor.
Because it could be coming from another problem.
It could be wax or
Right.
something simple, but in lieu of that, we cannot require it because the FDA does not require it. So we're just here to present a less expensive option. And I always say the same thing: get the best hearing aid you can afford. And ours is a great choice if you can't afford a custom product. I mean, that's a pretty standard
So
statement.
we're talking about under $200.
Yeah, it's $179 right now, and yeah, it's really we have thousands of satisfied users. I mean, this has been on the market for about a year, and
I'm amazed at how lightweight this is. You don't even know it's there.
right, we get letters every day about how it's changed and transformed lives. And I got to tell you, as a physician, we're used to that. On occasion, one-on-one, someone says, thank you, you changed my life or my child's life. But to be able to do it from a distance has been a very satisfying
Right. We've only got 2 minutes left, so I want you to tell everybody what you'd like them to know about anything that I haven't asked you.
Well, I just think that hearing loss is not, it doesn't get a lot of news play. It's not a sexy topic, but it's very prevalent. It's actually the third most common condition behind high blood pressure and arthritis. But again, and people just write it off and put it in a corner until it's too bad. But now we're hoping that something like this and you know, these kind of shows can bring some attention to it and how important that sense is.
And Doctor, where do you practice? Some people might want to come and see you.
So I'm in Northwest Indiana right now. I'm in Michigan City area, and that's where that newspaper article you were talking about initially. We'd be happy to see anybody.
So how could people contact you?
So
for
we're at
information?
St. Anthony Memorial Hospital in Michigan City.
Okay, so that's pretty easy to find. I found you.
Yeah, you found me. You did find me.
Well, I was so excited to find this because having experienced some of these things myself, you know, there are things that I do shows about that I haven't experienced, or I ask somebody to put me through something, to be the guinea pig for something so I can experience it, to talk about it. But this I've actually experienced as a problem with myself and relatives. So this is really exciting to me. So if you're interested at all, you want to email me at asktvnurse@yahoo.com. You can go to their website at mdhearingaid.com, and they will give you all the information that you need. And I'm thinking this would be a great gift for the holidays because the people could actually hear their relatives for a change.
You know, it really
Yeah.
makes families and life very happy.
I'm going to try one because I'm sure I have minimal hearing loss
Certainly.
from that, and I'll be able to hear everything then. You know? And then you got to be careful what you say on the phone when people can hear everything you're saying, right? Well, thank you so much for joining us, Doctor. It's been very enlightening. And if you have any questions, and they can email you too, I think.
Certainly, actually, if you go to the website, our access is there, our email.
Okay.
And we'd be happy to talk to anyone. Everything, you know, we've made it effortless as much as possible without doing it in person.
And you're easy to remember, mdhearingaid.com. So thank you for joining us.
Thank you for having me.
And thank you for joining us. We'll see you next time. Here's to your hearing.